Okay, go ahead.
Sir, there is a growing gap between the ratio of healthcare professionals and the Nigerian population. 1 out of every 4 Nigerians has the sickle cell gene. By way of introduction, how has the shortage of healthcare professionals affected the quality of sickle cell management and care?
Thank you very much. I think shortage of health professionals may be affecting the care of sickle cell patients, particularly in terms of providing information to intending couples, so that we can prevent, having sickle cell babies. If you provide information to intending couples so that they know their own genotypes, so that somebody who is AS does not say love is blind and gets married to somebody who is also AS. So I think that's the starting point. Providing information to the public so that intending couples will know that they must know their own genotype so that they don't go into marriage for the purpose of procreation or having babies with somebody who is also AS, because that increases the likelihood of having babies who will also have AS or who will be SS. So that's the starting point. At the second level, where shortage of healthcare professionals may be affecting the care of people with sickle cell disease, would be in terms of providing care for them. Care starting again from advising patients who suffer from sickle cell disease on some precautionary measures that they can take. For instance, not unduly exposing themselves to extreme weather conditions, adopting appropriate lifestyles, not putting themselves under stress, and so on. And then, of course, taking some prophylactic medicines, that can boost their immunity and boost their hemoglobin levels. So healthcare professionals are in a position to provide information for even those who already have sickle cell disease. And then, of course, on a third level, healthcare professionals are also required to now provide treatment for sickle cell patients who are experiencing one form of crisis or the other. So you can see that there are different ways by which healthcare professionals can provide information. So the shortage of healthcare professionals may impact definitely on the care for sickle cell patients. But we must not throw up our hands because we can still make do with, by training members of the community, by providing information to members of the community, so that members of the community themselves can pass on the message. While we wait till we get more health professionals trained. But we don't need to wait until we have one physician to every 400 population as they have in the United States before we do something about sickle cell disease. We can immediately, because largely lots of health education or public information can help to prevent the disease, by letting people have information that can help them so that they will not say that love is blind. So
Thank you very much, sir.
You're welcome.
So it is strongly believed that the quality of care determines desired health outcomes. With the highest burden of sickle cell disease in Nigeria, how can improved healthcare qualities and reduce the burden of sickle cell anemia in Nigeria?
Yes, as I mentioned earlier on, improved quality of healthcare will start from prevention. Will start from prevention, and one cost-effective strategy in disease prevention is providing information to members of the public, encouraging them to adopt healthy lifestyles. So that's very important, and health workers can play a significant role in that. So the healthcare system can play a significant role by providing information and then by improving access of people to care, so that people who need services are able to access the services. And thirdly, to ensure that the quality of the service itself, in terms of its technical quality, in terms of the technical competence of those who are providing service, is assured. And that can be assured through training and retraining of the health workforce, so letting them have the latest technology and having the latest knowledge with regards to the management of sickle cell disease. I can tell you now, at least I've seen a small number of sickle cell patients who are living into their 60s and 70s. Once the care is good and adequate attention is paid to appropriate care for them, they do well. And I am sure that very soon we will have the technology to even prolong their lives, particularly through bone marrow transplantation, which is just will soon be here.
So in line with technology you're talking about, you have recently been involved with pre-implantation genetic diagnosis with IVF patients at Medical Arts Center in Maryland, and also telemedicine is being utilized at LUTH. So what advances do you reckon, just like you mentioned earlier about bone marrow transplant, what advances do you reckon these and other research will hold for people with sickle cell anemia?
Well, I guess for sickle cell anemia, the best approach to it will still remain preventive. The best approach to it, because bone marrow transplantation, at least has been used for some other hemoglobinopathies and is very successful. And this hospital is going into partnership with a European institute that is involved in bone marrow transplantation. But of course, it's a little bit costly, and then there are some risks, particularly if you don't prepare the environment appropriately, because the risk of infection is very high in any transplantation, including bone marrow transplantation. So you'll have to bear all that in mind. So it will have been cheaper, and it will still be cheaper to prevent sickle cell disease through the provision of information at the appropriate stages, so that people, ladies who are having the trait and boys who are having the trait, are advised appropriately. So I think it's important for us to always emphasize the preventive aspect. Of course, there's a role for prenatal diagnosis, but I still prefer prevention to prenatal diagnosis. And then, of course, if it has happened and it's already on ground, bone marrow transplantation can come to help. And the technology for bone marrow transplantation is becoming more and more perfect, so that the results are becoming more and more reliable. Of course, as I said, we are going into collaboration with an Italian institute, because in the Mediterranean they have their own hemoglobinopathies in the Mediterranean, the thalassemias and so on. So we're going to be leveraging on the experience they have gathered over time in bone marrow transplantation. Of course, telemedicine is also useful because it helps us to access information, latest information, bank of knowledge, as well as throws open the opportunity for teleconsultation. The partnership we are going to go into with the European Institute in Italy is going to involve a lot of communication, and therefore telemedicine is going to be very useful in that respect.
So many Nigerian has witnessed the poor attitude or indifference of some healthcare professionals, especially with public healthcare providers. As a designated center of excellence, what quality improvement strategies has LUTH put in place as pertains care and management of sickle cell anemia?
Thank you. The first strategy, of course, is in our selection of staff, selection of personnel. We make efforts to select the best materials to work in the hospital. We make it very competitive. An entrance exam which comprises of different aspects, including some questions on attitude and professional competence and professional knowledge, and then of course being current in terms of current affairs and then civil service issues. So we during the recruitment exercise, we try to select the best materials, and then when they come in, we ensure that they undergo an orientation program. Mandatorily now, any new employee of the Lagos University Teaching Hospital will undergo an orientation program, which will include, lectures on attitudinal change, trying to get them to adopt modern concepts of customer service, as well as we also now subject them to training in basic life support strategies, so that every staff, particularly the health professionals, the nurses, the doctors, the pharmacists, the laboratory scientists, must undergo the training in basic life support. And then we subject some more senior people to advanced life support training and so on. So all that training and retraining process is to ensure quality. And then we have a unit in the hospital which we call the Servicom unit. That is the service compact which the government of Nigeria has with Nigerians. And that unit is headed by a professor of surgery. It's called, his designation is the nodal officer for Servicom. And we have posters all over the hospital showing or displaying a phone number that any unhappy or dissatisfied patient can call. So if a patient is not satisfied with the service that is being given, it's at liberty to call that number. And if he calls that number, a Servicom officer on duty will immediately come to the station where it's receiving service and will try to resolve the problem. And most of the time, 90% of the time, the Servicom officers are able to resolve the problem immediately. Only a small percentage of cases get to my table because the Servicom unit relays directly to my office. And if there's any particular situation that they cannot handle, then they will have to call me. And once they call me, of course, that situation has to be resolved.
Yes.
But the Servicom unit is able to resolve well over 90% of the cases by themselves, so they don't need to call me. The main challenge to this strategy for quality assurance is that the average Nigerian doesn't want to even make a complaint. Or they make a complaint, they want to make a complaint in a different way. You bring in a patient, this patient is almost dying, and you are not satisfied with the service, and there's a phone number you can call. You are refusing to call that number, then you wait until some unpleasant incident happens, and then you start complaining. When you could have made a phone call much earlier, because the whole purpose of providing the Servicom numbers in the accident and emergency, in all the wards, and in the children's emergency, is so that any patient or relative of patient who is not satisfied with service can make that phone call, so that the Servicom unit can intervene to ensure that the quality of service is appropriate. Of course, another strategy that we use in ensuring quality of service is that we do not employ or we do not allow to work in the hospital any health professional that is not registered with the appropriate professional regulatory body. That's a quality assurance process. So all our professionals are appropriately registered with relevant professional regulatory authorities in the country. And we have people who also have registration with regulatory authorities even outside the country. So all that ensures that we have quality manpower on ground, and then we have protocols in the different departments or standards of practice, SOPs in the different departments, to ensure that quality is maintained. Quality is the watchword.
Thank you very much
Most welcome.
for granting us this audience. And we believe this interview has added immense value to our documentary. And we believe this will go a long way in raising more awareness for sickle cell and for people living with sickle cell. And this becomes very important now that the World Sickle Cell Day is just around the corner on the 19th of June. We appreciate it, sir.
Thank you. I
Thank
wish
you
you all
very
the
much.
best.
Thank you very much,
Send me
sir.
a copy of the recording.
Yes,
Okay,
sir. Yes, sir. Thank you, sir. Yes, sir.
Thank you, sir.
Thank you, sir.
You are welcome.
Yes, sir.
Have a blessed day, sir.
And you too.